As we finish this chapter and talk about safe infant feeding, the goals are to avoid bacterial contamination, wash your hands before preparing formula, clean bottles and nipples by washing them in a dishwasher or placing them in boiling water for 5 minutes. Boiling water for 1 or 2 minutes and cool it before using it to mix powdered formula, or if you're diluting concentrations, to cover and refrigerate open cans of ready-to-feed and liquid concentration formula and use formulas within the period indicated on the can, and prepare formula immediately before feeding and discarding any excess. Let's talk a little bit about food allergies. They're common in infants due to their immature digestive tracts that allow for absorption of incompletely digested proteins, because remember we learned about food allergies in the protein chapter, and these proteins trigger the immune response. We know that the risk of developing food allergies reduces after the age of 3, and many children who develop food allergies before 3 eventually outgrow them. But allergies appearing after 3 years are more likely to remain. We know that appropriate introduction of solid and semi-solid foods can reduce the risk of an infant developing allergies. The most commonly recommended first food is iron-fortified infant rice cereal mixed with formula or breast milk. We do absolutely recommend exclusive breastfeeding for the first 4 to 6 months. Lots of people are very anxious to introduce foods versus formulas. But we know the first one needs the iron-fortified infant rice cereal mixed with formula or breast milk. It's easily digested and rarely causes allergic reactions. And then after this rice cereal has been successfully included in the diet, other grains can be introduced, with wheat cereal given last because it's more likely than other cereals to cause an allergic reaction. We know that each new food should be offered for a few days without the addition of other foods, and if an allergic reaction occurs, it is then likely that the newly introduced food caused it. And foods that cause symptoms such as rashes, digestive upsets, and respiratory problems should be discontinued, and the symptoms should no longer be present before any other new foods are added into the diet. Solid and semi-solid foods can be introduced starting at 4 to 6 months. You want to make sure you're adding developmentally appropriate foods. We know that the formula and the breast milk are meeting 100% of their needs. But at about 4 to 6 months of age, more towards the 6 months, the infant's feeding abilities and GI tract develop and mature enough to handle solid foods. We know that cow's milk should never be fed to infants because it's too high in protein and too low in iron. At 1 year of age, whole cow's milk can be offered, and you want to make sure you use whole milk until at least 2 years of age. And after that, reduced fat or low fat milk can be used. And as a child becomes more familiar with a variety of food choices should be made from each of the food groups. Important to avoid choking during this age. Foods that can be easily lodged in the throats, like raw carrots, grapes, hot dogs, should not be offered to infants or toddlers. The American Academy of Pediatrics and the dietary guidelines recommend that fruit juice as well not be introduced until after 6 months of age, and then be very limited to 4 to 6 ounces per day, and only 100% fruit juice should be offered. Should only be offered from a cup And juice consumed from a covered cup or bottle encourages consumption over a long period of time, which may cause some of that infant mottling or teeth. So you don't want it in a sippy cup. If they drink it in a cup, and that's it, and they're not sipping it all day long so that their teeth don't rot. Honey should not be fed to children less than 1 year old because it may contain spores of Clostridium botulinum or botulism spores, and can cause botulism poisoning. Older children and adults are not at risk from the botulism spores because the environment in a mature GI tract prevents the bacteria from growing. So that just kind of covers all of that. I was a little ahead of myself. Nourishing a developing infant, foods that are offered to infants should be appropriate for their developmental and digestive abilities. So birth to 6 months, so mostly developmental milestones are sucking. Solid food is usually pushed out as their tongue is pushed forward, and breast milk and iron fortified infant formula during that time. 4 to 6 months, the tongue is held farther back in the mouth. This allowed solid food to be accepted without being expelled, and the infant can hold his or her head up and is able to sit without support. So you're continuing the breast milk or formula, adding iron fortified infant cereal. Rice cereal is usually the first, and then other grains, and you're adding one food at a time. Pureed vegetables and fruits last because they're more likely to accept the vegetables because they only know that sweet. And at 6 to 9 months, the infant should be able to sit without support, chew whole food, easily move hand to mouth. Continuing the breast milk formula, iron fortified infant cereal, pureed or strained vegetables and fruits, meats and beans, and limited finger foods. And then 9 to 12 months, we can see this infant can drink from a cup or feed himself. And continuing still with the breast milk formula or iron fortified cereals, chopped vegetables, soft fruits, meats and beans, non-choking finger foods like dry cereal, cooked pasta, and well-cooked vegetables. And that is the end of chapter 11. And you want to make sure that you really understand the changes in the body during pregnancy, the nutritional needs during pregnancy, factors that increase the risks associated with pregnancy, lactation, and nutrition for infants.